When someone shows signs of depression, their first stop is often their primary care provider's office. Primary care providers are increasingly involved in mental health care, writing nearly 2/3 of antidepressant prescriptions.
As a family caregiver, you play a crucial role in supporting your loved one's medical care and ensuring that their PCP is receptive and responsive to your loved one's concerns. Unfortunately, difficult situations sometimes arise when accessing care. Here are some examples and strategies to get through them. Your loved one is showing signs of depression, but will only talk to their PCP about what's going on. You worry that because the PCP isn't a mental health clinician, they don't have enough specialized knowledge to help. Your loved one may be more likely to get a thorough evaluation from a mental health clinician, but seeing a PCP can be a good first step.
Loved ones may feel more comfortable talking to a PCP they know and trust versus a mental health clinician they have never met. PCPs can rule out biological illnesses. You are more likely to get an appointment sooner with a PCP than with a mental health specialist.
Your loved one may be hesitant to include you in appointments with their doctor. People dealing with depression don't always function as they normally would. Remind your loved one that you can help describe symptoms and behavior changes to the doctor. Offer to set boundaries for appointment discussions, such as who will talk first or answer the doctor's questions. Your goal is to build trust, so your loved one is more likely to include you in the future.
The brain is still somewhat of a mystery, even to the best doctors in the world. Your loved one's PCP is a trained medical professional, but one who probably does not have a specialty in mental health or psychopharmacology. Also, health insurance companies often have policies that require patients to try the cheapest medications first, which can influence which ones are prescribed. Medications can be hard to get right, but there are ways to advocate for the best options. Ask the PCP for a referral to a psychopharmacologist. If the generic medications are not working, contact your loved one's insurance provider and ask about which medications are covered.
You may have critical information about your loved one's behavior or symptoms, but they have barred you from attending the appointment with the PCP. The PCP says they can't talk to you without your loved one's consent because of privacy laws. In this scenario, the PCP may not be able to talk to you, but they can listen. Call and simply report the information without asking for a response. Listening to you does not violate privacy laws, and the PCP can make their own decision about whether the information is relevant and useful. Ask the PCP to speak to your loved one about sharing information with you so you can provide effective support.
You or your loved one may not be satisfied with the referrals provided by the PCP. A possible solution is to call your loved one's insurance company and get a list of specialists in their covered network. You can research the options online or call to learn more about a provider's services. Put social stigma aside and ask friends, neighbors, or relatives for recommendations. Dealing with depression symptoms can be overwhelming, but remember that you are your loved one's best advocate. We encourage you to speak up for them so they can get the care they deserve.
Visit our website at familyaware.org for more information and resources, such as a depression symptoms checklist, mental health family tree tool, and depression wellness analyzer.